Welcome back to the Victory Education Lounge, everyone. I'm your host, Maurice, and today we're diving into part 22 of our series on insulin resistance. Before we begin, please take a moment to like this video, subscribe to our channel, and leave a comment sharing your thoughts or experiences below. Your engagement helps us reach more people with this crucial information. Today we're exploring insulin resistance and its role in metabolic syndrome. We'll delve into how insulin resistance is a key player in this cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. We'll discuss the interconnections, potential solutions, and prevention strategies, along with their pros and cons, and provide real-life examples to illustrate these points. Let's start by understanding that insulin resistance is often considered the cornerstone of metabolic syndrome, a complex web of health issues that affects millions worldwide. Ever wondered how insulin resistance plays a role in metabolic syndrome? Well, you're not alone. This topic has been the subject of extensive research and discussion within the medical community. Insulin resistance, a condition where your body doesn't respond as well to the insulin it makes, can set off a chain reaction of health issues, often culminating in what we call metabolic syndrome. This syndrome is a cluster of conditions including high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Understanding the relationship between insulin resistance and metabolic syndrome is crucial, as it can have a significant impact on our health, potentially leading to serious complications like heart disease and type 2 diabetes. So buckle up and get ready to delve into the world of insulin resistance and metabolic syndrome. Let's start with the basics. What are insulin resistance and metabolic syndrome? Insulin resistance is a condition in which the body's cells become less responsive to the hormone insulin. This hormone, produced by the pancreas, is crucial for regulating blood sugar levels. When cells become resistant to insulin, the pancreas works overtime, producing more insulin in an attempt to keep blood sugar levels stable. Over time, this can lead to higher levels of insulin in the blood, a condition known as hyperinsulinemia. Now, let's tackle metabolic syndrome. This is a cluster of conditions that occur together, significantly increasing the risk of heart disease, stroke, and type 2 diabetes. These conditions include increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. Insulin resistance and metabolic syndrome are closely interconnected. In fact, insulin resistance is often considered the cornerstone of metabolic syndrome. This is because the issues that arise with insulin resistance, such as high blood sugar and abnormal lipid levels, are key components of metabolic syndrome. Given the prevalence of these conditions, it's not an exaggeration to say that we're facing a global health crisis. Millions of people worldwide are affected by insulin resistance and metabolic syndrome, and these numbers are only expected to rise. Understanding the role of insulin resistance in metabolic syndrome is critical. As insulin resistance progresses, it can lead to a host of health problems that are part of metabolic syndrome. This includes heart disease, stroke, and type 2 diabetes, among others. Moreover, these conditions don't exist in isolation. They're all part of a complex web of health issues that can have a significant impact on a person's overall well-being. This is why it's so important to address insulin resistance as part of a comprehensive approach to managing and preventing metabolic syndrome. Now that we have a basic understanding, let's delve into the specific aspects of these conditions. Insulin resistance and metabolic syndrome are broad conditions that can affect various aspects of your health. These conditions are not isolated, but rather form a complex interplay of several health issues. To better understand the scope of these conditions, let's dive into 10 key aspects of insulin resistance and metabolic syndrome, using real-life examples to illustrate each point. Firstly, we have central obesity. This refers to the excess fat around the abdomen, which is strongly linked to insulin resistance. Consider Sarah, a 45-year-old office worker. Her waist circumference of 35 inches places her at a higher risk of developing metabolic syndrome. Secondly, there's high blood pressure. Persistent high blood pressure or hypertension often goes hand in hand with insulin resistance. Take the case of John, a 50-year-old man with a consistent blood pressure reading of 140/90ths mmHg. His doctor explained to him the link between hypertension and insulin sensitivity. The third aspect is elevated fasting blood sugar. This is a hallmark of both insulin resistance and metabolic syndrome. For instance, Maria, a 38-year-old woman, found out that her fasting blood sugar of 110 mg/dL increased her risk of metabolic syndrome. Fourth, we have high triglycerides. These blood fats often rise when insulin resistance is present. Tom, a 55-year-old man with triglycerides of 200 mg/dL, was surprised to learn about the connection between high triglycerides and insulin function. On the fifth spot, we have low HDL cholesterol. Reduced levels of this good cholesterol are common in insulin resistance and metabolic syndrome. Lisa, a 40-year-old woman with an HDL level of 40 mg/dL, discovered this could be due to insulin resistance. Next, there's the pro-inflammatory state. Chronic low-grade inflammation is associated with both insulin resistance and metabolic syndrome. David, a 60-year-old man with elevated C-reactive protein levels, was educated about this inflammatory aspect of these conditions. The seventh aspect is the pro-thrombotic state, where there's an increased risk of blood clots. Emma, a 35-year-old woman with high fibrinogen levels, learned about this less-known aspect of metabolic health. Eighth, we have non-alcoholic fatty liver disease, often seen in individuals with insulin resistance and metabolic syndrome. Mike, a 42-year-old man with slightly elevated liver enzymes, found out about the liver's role in metabolic health. Ninth, we have polycystic ovary syndrome, or PCOS. In women, this condition is strongly linked to insulin resistance and metabolic syndrome. Janet, a 30-year-old woman diagnosed with PCOS, discovered its connection to broader metabolic issues. Lastly, there's the increased cardiovascular risk. The combination of these factors significantly raises the risk of heart disease and stroke. Robert, a 58-year-old man with multiple components of metabolic syndrome, was informed about his elevated cardiovascular risk. These aspects highlight the complexity of insulin resistance and metabolic syndrome. Understanding these factors is crucial in managing and preventing these conditions effectively. Now, you might be wondering, what can we do about insulin resistance and metabolic syndrome? Well, there are several strategies that can help manage and even prevent these conditions. First off, lifestyle modifications are a cornerstone in the management of insulin resistance and metabolic syndrome. This includes adopting a healthy diet rich in whole grains, lean proteins, fruits, vegetables, and healthy fats, regular physical activity, and maintaining a healthy weight. These changes can significantly improve all aspects of metabolic syndrome without side effects. However, the challenge lies in maintaining these changes long-term. For instance, consider the case of Lucy, a 48-year-old woman who managed to reverse her metabolic syndrome by adopting a Mediterranean diet and incorporating daily walks into her routine. Secondly, medication can be used to manage individual components of metabolic syndrome such as high blood pressure, high blood sugar, or high cholesterol. The advantage of medication is that it can provide rapid control of these conditions. However, medications may have side effects and do not address the underlying cause of metabolic syndrome. Take, for example, Sam, a 52-year-old man who managed his high blood pressure with medication, but found that lifestyle modifications were needed to manage his metabolic syndrome as a whole. Thirdly, early detection and regular monitoring are key prevention strategies. Regular checkups can help identify early signs of insulin resistance and metabolic syndrome, allowing for early intervention. This approach can be effective, but it requires commitment to regular medical appointments. Let's consider the case of Rebecca, a 40-year-old woman who was able to prevent the full-blown onset of metabolic syndrome through early detection and strict monitoring of her blood sugar levels. Lastly, stress management techniques such as mindfulness, yoga, and meditation can help manage insulin resistance and metabolic syndrome by reducing the body's stress response, which is known to exacerbate these conditions. These techniques can be effective and have additional mental health benefits. However, they require time and commitment to practice regularly. Consider the story of Mark, a 50-year-old man who incorporated daily meditation into his routine and noticed a significant improvement in his blood pressure and blood sugar levels. In conclusion, managing insulin resistance and metabolic syndrome involves a combination of lifestyle modifications, medication if necessary, early detection and regular monitoring, and stress management techniques. Each approach has its own set of pros and cons, and what works best will depend on the individual's circumstances, preferences, and medical history. Remember, managing insulin resistance and metabolic syndrome is a journey, not a destination. It requires perseverance, patience, and a commitment to overall health and well-being. Like Lucy, Sam, Rebecca, and Mark, it's about finding the strategies that work best for you and sticking with them. So let's keep the conversation going. Share your stories, ask your questions, and let's learn from each other. So, we've covered a lot of ground today. We've navigated the labyrinth of insulin resistance and its pivotal role in metabolic syndrome, a complex network of health issues affecting millions around the globe. We've looked at its key aspects, from central obesity and high blood pressure to a pro-inflammatory state and increased cardiovascular risk. Real-life examples have brought these points to life, helping us relate to these conditions and understand their implications better. We've also explored potential solutions, management techniques, and prevention strategies, emphasizing the power of lifestyle modifications while acknowledging their pros and cons. It's clear that tackling insulin resistance and metabolic syndrome requires a multifaceted approach and a deep understanding of these conditions. Thank you for joining us for this exploration of insulin resistance and its role in metabolic syndrome. I hope this information helps you understand the interconnected nature of these conditions and empowers you to take steps towards better metabolic health. Remember to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Stay tuned for our next video, where we'll discuss emerging therapies for managing insulin resistance and metabolic syndrome. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice or to replace consultation with a qualified healthcare professional. Always consult your doctor before making significant changes to your lifestyle or starting any new health regimen. Remember, knowledge is power, and understanding insulin resistance and metabolic syndrome is a key step towards a healthier future.